Happy Nurses Day. Nursing has always been a hard job, in part because the work itself is inherently demanding in so many levels, and in part because most of the time we can only do the work as employees of some kind of business. If you, like me, as a student nurse, you didn't give much thought about the economics involved in the places you'd eventually work, because there was so much else to learn. But business imperatives are largely behind all those lunch breaks you didn't get to take. Today, please enjoy what we hope will be an uninterrupted lunch break. We have a few speakers for you, and we'll hear from some of the organizations who've set up informational tables in the back. Every Nurses Week, for a short period of time, American News focuses on nurses, the history of the profession, the work we do, and the ways that work touches people's lives from the beginning to the end. We hear stories about our difficulties in the healthcare industry, opinions about why things are the way they are, and proposals for how they might be made better. This information usually comes from people representing institutions or large organizations, and they may not represent the reality as we know it. So today we have an open mic where you can have a chance to tell your own story. You can sign up at the check-in table and have your say, city council style, for up to 3 minutes. Since public speaking is usually near the top of the list of things Americans find to be terrifying, we also have reporters here, some of whom are students. Please take the opportunity to answer their questions and tell your own nurse's story. As a new grad in 1974, I was already aware that there was a nursing shortage. I was flattered to be given quite serious responsibilities straight out of school. Evening charge nurse in a pediatric ICU. I'd worked in ER as an aide during my training and done an extra rotation in peds, so clinically I was not as green as many of my peers. But Children's had a lot of really sick patients, and we were constantly scrambling to keep up. I began to stay late to help the next shift and sometimes worked a double 8-hour shift because I just couldn't leave those little kids when there were not enough nurses to take care of them. I thought the lack of staff must be an aberration, perhaps because of the Vietnam War, which was still going on when my training ended. But it turned out that inadequate staffing was a persistent pattern wherever I worked. Fast forward about 10 years, I was working in the Level 1 Trauma Center in San Francisco's Mission District. We had a bulldog head nurse, Mission Mary, who smoked while triaging and told everyone who came through the department, "These are my nurses. They are the best, and they're going to have whatever they damn well need to get this job done." She was at the helm when a new illness, characterized by blotchy purple skin lesions, started showing up in our gay patients. It was a rough time, but Mary fought to support the frontline nurses, and we were rarely short-staffed. But we had a different problem. Our beds were staffed, but there weren't nearly enough of them for the volume of patients we received. Wait times back in the 80s were 5 to 6 hours long, routinely, and occasionally someone died while they were waiting. What emerged from those early years of experience was a recognition that there was a consistent tendency in every hospital to always have as few nurses on duty as possible. Since we are the deliverers of the majority of care and the monitors, literally at the time, of the patient's condition, it only made sense to make sure nurses had the time required to always provide proper care. So I went to business school. Economics and accounting were a revelation. I discovered that different parts of our staggeringly complex healthcare system operate under conflicting incentive systems, and the mechanisms in place to enforce regulations and accountability are archaic and mostly opaque. Yes. No wonder it doesn't work well. I have watched generation after generation of new nurses come to the bedside, eager and determined to do their best, but without the time and support that requires, they are set up to fail. Direct patient care in hospital or extended care facilities becomes something they want to escape, so they leave. to pursue more education that will qualify them for positions away from the bedside, or they leave nursing altogether. They become desperate to get away from the stress of not being able to actually do the job they trained to do. Over time, I've observed the pattern. Eagerness turns to frustration and then to despair. And I've often found a new nurse crying in the med room. Anybody else seeing that? Yeah, a lot of heads nodding. Their common dilemma: I love taking care of my patients, but this is impossible. I can't do this. I have to get out of here. The younger generations are not sticking around. They're dropping out sooner after graduation. More than 20% of new RNs will leave professional practice in the first 2 years after graduation. In nature, there are organisms, often animals, that can detect risks to humans by providing advanced warning of dangers. They are called sentinel species, and a classic example being the canary in the coal mine. We have some canaries with us here today. In the late 1800s, miners brought caged canaries into the mines because the birds were more sensitive to toxic gases, primarily carbon monoxide, that could silently kill the miners. The canaries would become sick before the humans, thus giving them a chance to escape. It didn't end well for the canaries. Those nurses crying in the med room, leaving the profession, and sometimes marching in the streets, are the canaries in the healthcare system mine, a warning of serious dangers in the system. For over 100 years, most of us nurses have stood silently by while nursing organizations and institutions that only a tiny fraction of us participate in have spoken for our interests. Our participation rates in these organizations continues to decline, and that has brought us to where we are today. With each wave of nursing crisis, the experts invariably arrive at the same conclusion. We need more canaries. We need more educated canaries. We need differently educated canaries. But the solutions never make a lasting difference because the real problem is that the mines are toxic. What we old nurses want you to know is that you didn't cause this, and that the people in organizations who've been a part of perpetuating this mess aren't likely to change course unless more of you participate in those organizations. And in the political processes that impact the healthcare industry. You have technology that allows you to readily connect with each other and to easily subscribe to sources online where you can follow legislation with potential to have a tremendous impact on healthcare. You can find out what your rights are and join with communities pursuing solutions you're passionate about. The work you do is so important. It's valuable in ways that throughput measures and so-called quality measures are blind to. Don't give up, please.